Cutting machine. You can cut here below. This is the first rib which is there here. So you can break here and you can make it a cut. So this is the first rib. Below this clavicle we have the first rib. So here we have to cut and open because we also maintain the features or muscles of the structures of the neck also. So that lift here, take up. This is the pericardium which is attached. Pericardiosternal ligaments. These are the pericardiosternal ligaments. So I am cutting the pericardiosternal ligament. Lift. Both sides. कट करता हूँ. Bypass heart surgery is like this way. We are going to remove. So here you have to cut it here, and you have to cut it. Cut करा है तो cut it. धरा है करना. सबका. बोन कट रहा है का इथं ट्रेमध्ये का तिकडे इथं कट करा सावकाश ब्लेड here. This all is a pericardium. काढायचं. This thoracic plate. Here you can see the sternum and ribs, which are both the sides we have cutting. Sternum and both the side ribs. Okay. After removing, you can see the thoracic organ. Here you can see this is a heart situated covered by the pericardium. These are the two lungs, right and left lung. So I will show you the pericardium incision, how to take the pericardial incision. This is the pericardium. How many layers of pericardium? Pericardium, parietal and visceral. Okay. So parietal and visceral we have, and this I am cutting the parietal pericardium and entering into the pericardial cavity. Then we are entering into the heart. So here you can cut it. This all is the So bypass also we cut like this way, reflected, and we are going to use the pericardium. Fibrous. Here also we can have. See, this is always the pericardium. Serous pericardium. This is, you can see now. This is a pericardium. This is, you can see, covering of the heart. That is the pericardium. You can see. So this I am reflecting the pericardium laterally. We can visualize the heart properly. So, So you can see heart, how it is you are going to see. Here we have to get the inferior vena cava. If I cut inferior vena cava, you are going to enter See here, all heart branches of the great vessels. You can see, come and touch and see. And this is the one which is right atrium, right ventricle, left ventricle, and left atrium behind. So these all we are going to see. Is it clear? So heart afterwards we will remove. Before that you can see this is all pericardium and this is the heart. Then we have the right lung, left lung. So now I am going to dissect even heart. Heart also we are going to remove. Sudhadhara, hold this one. So I am going to dissect, remove the heart with its great vessels. You can see here we have dissected the inferior vena cava, and this is the heart total. So we are going to cut it and dissect. Blade is okay. Here I am going to separate the superior vena cava. Here. इथं दोन्ही साईडला finger, don't bring the finger. Heart replacement. Can you imagine how difficult it is? That I am doing this much work. And in the living person, how heart transplant, you can understand why doctor is God, called this way. So that is the imagine just to see the so all pericardium I am separating. Here we can see now all superior vena cava, this inferior vena cava, pulmonary trunk, and this we are going to get the aorta. Yeah. And separating the aorta, descending thoracic aorta here. Here you can see this is a descending thoracic aorta. Lift it. Aorta is cut. can see heart. These are the branches which is you can going to see. This is the which we are going to get the pulmonary trunk and the superior vena cava, aorta arising from the left ventricle. This is arch of aorta is here. You can see descending thoracic aorta. I wanted to remove this, but here, here trachea. You can see below this. We are going to get the trachea. This is a trachea, and below that is esophagus. This is a trachea, right and left bronchus. You can see. Can you see? And this is the esophagus. ये trachea है. This is a trachea, which is you are going to see bronchus, and this is a esophagus. So this is see esophagus, and this is a thoracic aorta, descending thoracic aorta, esophagus, and this is a trachea. So this is all about the you have about the thorax. This taken. Yeah, I can put it. Dissected here. You can see this is the right atrium, inferior vena cava. This is superior vena cava. This is the inferior vena cava. This is a chamber, right atrium, and we are going to get the. This is a right ventricle, triangular in shape, right ventricle, arising with that is a pulmonary trunk. This is a left ventricle. Apex of the heart is. We are going to get the here left ventricle, and that arises, that is arising from the left ventricle is aorta. These all are the three branches of the arch of aorta, and this is superior vena cava. Then when you go to the posteriorly, you have the four pulmonary veins. See, you can four pulmonary veins in this is a chamber of the left atrium, and this is a base of the heart. Base of the heart, four left, that is we right and left pulmonary veins. Okay, and here you have the inferior surface, anterior or sternocostal surface, or this inferior or diaphragmatic surface, and this is the left surface. Three surfaces: left, sternocostal or anterior, and this is the inferior. This is the apex formed by the left ventricle. Base is formed by the left atrium. Okay, so this is what you have to remember. This is what we call as a right auricle, and this is a posteriorly we call left auricle. This is what is left auricle, and this is a right auricle. What the interiorly of auricle contains a muscular pectinity, and that will prevent the free flow of blood. Minor small clots rush over that, and they will cause the dissolving of the total clotted blood, which is dissolved on pushing over the muscular pectinity inside this. So this is one which is you have to remember.